Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracedo is interpreting the press conference in Spanish. This interpretation will be available immediately following the conclusion of the press conference. This has been a very difficult week in the local, state, national, and global effort to combat the coronavirus pandemic. On Monday night, state health officials informed all county public health departments of a technology issue that is suspected of causing a significant undercount of completed tests and test results throughout California. When COVID-19 tests are conducted in California, information is inputted into the California Reportable Disease Information Exchange, also known as CalReady. While examining a steep decline in the number of tests completed and positive test results, the state discovered that recent testing information entered into the system was delayed in entering the system or not reported at all to the California Department of Public Health and county public health departments. The result is a serious concern of a significant undercount of positive COVID-19 test results throughout California. In response to this issue, the California Department of Public Health is working with labs and counties to revert to a manual reporting system. This statewide issue has likely affected the accuracy of our local numbers. We will continue to work with the State Department of Public Health to update and reconcile testing information as it becomes available. The state of California announced today it had identified the sources of the technological failures and hoped the system would be back online late next week. In the meantime, our county public health department is working very hard to fill this gap by manually recording local case data. We are cautiously optimistic the state's data collection platform will soon resume reporting accurate, comprehensive local and state case data as soon as later next week. This week, COVID-19 deaths in California pushed through the 10,000 total threshold, and the United States has now exceeded 160,000 total COVID-19 deaths. If the current trend continues, the U.S. death toll from COVID-19 could exceed 300,000 people by the end of the year. This would make COVID-19 the third highest leading cause of death in the United States after heart disease and cancer, and a bigger killer than accidents, stroke, and Alzheimer's disease. There are also new COVID-19 outbreaks occurring in countries around the world that had successfully handled the first wave of the pandemic. Following the easing of physical distancing measures, lockdowns, and the relaxed perceptions of the dangers of the new coronavirus, several European nations are noticing an uptick in confirmed COVID-19 cases and bracing for a second wave. Data from the World Health Organization's European division shows that countries with the highest number of cases in the last 14 days include Russia, Turkey, the United Kingdom, Spain, and Germany. Germany had been praised for its decisive response to the first coronavirus surge. Early government shutdowns and mass testing there is credited with limiting German COVID-19 deaths more than any other European country. Unfortunately, Germany is now experiencing its second wave of coronavirus infections. There is concern that early success could be lost as people get tired of the rules and want to get back to normal life. Health authorities worry that Germans are getting too lax in respecting mask wearing and social distancing rules. Vietnam on Thursday reported more cases of COVID-19 as the first outbreak in over 3 months spread to cities across the country. Vietnam has also been recognized as a global leader in the fight to contain the coronavirus pandemic, with very few reported cases and deaths as compared to neighboring Asian countries. What is the consistent lesson that should be learned from our local, state, national, and global experience with the coronavirus pandemic? The most important lesson is that our own personal behavior matters. Countries that acted early to shut down and isolate people were successful in stopping the spread of the virus. People in a staggeringly diverse range of countries all over the world cooperated, and the infection curve flattened. Many lives were saved from those significant early steps. Our experience locally and statewide mirrors that same pattern. Governor Newsom's stay-at-home order successfully preserved hospital capacity in California, prevented the crashing of our medical system from an uncontrolled surge of COVID-19 patients. This early success led to the reopening of businesses and a general feeling that we had survived the worst of the pandemic. Unfortunately, it's now very clear that early success has led us to a collective false sense of security. When businesses reopened, people mixed together, and the virus is spreading throughout communities across the state. The governor's subsequent statewide mask order has helped, and as more local residents are again taking personal responsibility to help stop the spread of the virus, we will hopefully soon be able to demonstrate positive progress. The second lesson from the status of the coronavirus around the globe is that we must avoid the roller coaster effect of feeling that we are past the need for physical distancing and wearing face coverings. Until there is a widely available vaccine for COVID-19, we must accept the reality the virus is with us, and we must consistently take steps to protect ourselves, our loved ones, and our neighbors. As difficult as it is, we must get used to the idea that wearing face coverings is necessary when we are close to other people. Face coverings also do not replace the need to maintain physical distance from others, because the longer that close contacts occurs, especially in confined space or in crowds, the greater risk of spreading the virus. Our destiny and the outcome of the pandemic is not predetermined. Our fate is governed by our individual and collective action. We can get this pandemic back under some degree of control if we can keep our businesses open. We can reopen our schools if we commit to accepting the reality that we must remain vigilant and committed to the new pandemic normal. We will get through this together. Finally, I'd like to conclude by reminding local residents and visitors the unofficial traditional Fiesta cruiser bicycle ride that would normally happen this Sunday is a very bad idea this year. City and County of Santa Barbara officials have reached out to the event organizers to ask that the ride be canceled. The event organizers have been very cooperative, but the informal status of the event has led to concern that thousands of participants may still plan to do the ride anyway. I noticed the Boston Marathon has been canceled for the first time in its 124-year history. The race, the most prestigious marathon in the United States, has been held annually since 1897, even amid world wars and periods of domestic tension and in snow and rainstorms. Instead, organizers intend to hold a virtual marathon with people running the 26.2 miles independently. I see an exciting opportunity to blend the Boston Marathon strategy to the Fiesta Cruiser ride. I hope local residents take this moment to reinvent the Fiesta Cruiser ride like the Boston Marathon has done, converting the group ride into an individual experience wearing masks. This is the year to demonstrate how we can creatively adapt to the presence and reality of the coronavirus and still maintain a safe, healthy, fun tradition. Next, we'll hear from Dr. Del Reynoso, the county's public health director.
Thank you. I'd also like to provide you with an update on the state disease registry system known as CalReady. As Supervisor Hart mentioned, over the next few days, the backlog will be processed. CDPH estimates 250 to 300,000 records statewide will be processed, and some of these might be duplicates. CDPH will be making upgrades to servers to avoid future outages, and they now have a redundant system to validate the reports. CDPH noted that patient care and test results have not been affected or delayed by this issue. Laboratories continue to report test results directly to providers and hospitals, and hospitalization and death rates are not impacted as they are reported directly to the state through different systems. CDPH also advised that the technology issues has led to an underreporting of cases at the local level. While clinicians are still able to report to local health departments, this issue may impact local health departments' ability to receive all lab results in order to do the case investigation and contact tracing. So to minimize the impact of this incomplete information from the state to our department, my team has reached out to the labs who are processing the tests to directly fax results to our department. We have reassigned staff from other programs to our disease control unit to enter the positive results into CalReady so that we can continue to do case investigation and contact tracing in a timely manner. My goal is to continue with keeping our community fully informed on the information as it becomes known. Thus, this afternoon, we are reporting 58 new positive cases with a total number of 198 cases classified as still infectious. Unfortunately, we're also reporting an additional death related to COVID-19. This person was over 70 years of age, a resident of the city of Santa Maria. This person did have underlying health conditions, and we extend our heartfelt sympathies to this community member's loved ones. Again, we are providing you with the best information that we currently have. I want to stress that our local data is underreporting of the actual number of tests performed, the case rate, and the testing positivity rates until the state resolves their data issues with electronic lab records and CalReady. Thank you.
Thank you, Dr. DeReynoso. Next, we'll hear from Dr. Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. I have two important things I would like to talk about today: gatherings and the recently released state guidance on youth sports. With the beginning of the yearly tradition of Old Spanish Days Fiesta in Santa Barbara, it is very important for people to remember that gatherings of any size are not safe, and that mixing and mingling is the most common way that COVID-19 is spread to others. A gathering is defined as any event that brings people together who do not reside in the same household. Even get-togethers with extended family or friends who do not live in our household for a backyard barbecue or other social event has become one of the most common ways to spread the virus. The risk of contracting COVID-19 is significantly increased in crowded places with close contacts to others. This year, La Fiesta will need to be celebrated differently from usual. Our behaviors over the next several days will determine the level of infection and disease we will see in the weeks to come. Please avoid all activities that will lead to close contact or that would promote congregating. Please wear a face covering and maintain your distance from others. Enjoy the many virtual opportunities to share Fiesta through televised activities. The state recently released guidance for youth sports, and at this time, I would like to share that information with you. The guidance is for school-based as well as club and recreational programs. Due to the very high transmission rate of the coronavirus in our area, conditioning and training should focus on individual skill building, for example, running drills and body weight resistance training without use of equipment. You may be asking why youth sports are allowed when school is not allowed. The reason is that youth sports are only allowed under very narrow circumstances, including being outdoors only, maintenance of 6-foot distancing, and avoidance of all contact between athletes. At this time, tournaments, events, or competitions, regardless of whether teams are from the same school or from different schools, counties, or states, are not permitted, as this would promote congregating and lead to viral spread. In closing, please remember, avoid mixing and mingling with people not from your household. Keep at least a 6-foot distance from others. Wear a facial covering when recommended to do so. Wash your hands frequently with soap and water. Avoid touching your eyes, nose, or mouth. Please stay home when you're sick. Do not go to work or other places. Thank you for your cooperation.
Thank you, Dr. Ansorg. Suzanne Grimacy is also here with us today to share information about community wellness.
Thank you. I would like to speak today to the ways that we can support our youth with the impacts of COVID-19 and with all uncertainties that this pandemic has brought to their young lives. The pandemic has impacted everyone, no matter the age, and not just within our community, but globally. But the impact on the social, emotional development of our youth is unique, as the brains of our children and youth are still developing and need the engagement and the interaction of others for their healthy development. Two key ways our children get the psychological nutrition they need is through sports or physical activity and school. I first want to speak to sports. As Dr. Onsorg mentioned, with the recently released state guidance on youth sports, training and conditioning can take place while following safe guidelines. Children's brains need physical activity to stay psychologically healthy. If your child has stopped exercising, you may notice an increase in emotions, especially irritability. Children and adolescents who are used to being physically active, their brains are used to this activity too, and they need it. Their brains need physical activity to stay psychologically healthy. We know that brains work best when they have regular physical activity. Concentration and focus will be especially challenging for many students as they dive back into learning remotely rather than in person. Moderate exercise for at least 20 minutes has been shown to increase the ability to focus and learn in the few hours after the exercise. In addition, exercise promotes better sleep. Ways that parents can help children be physically active include making physical activity intentional. If you don't plan it, it's probably not going to happen. Block out time for exercise. Make a schedule. Model for your kids, and this will keep the whole family on track. Let kids choose. Everyone needs to feel in control of themselves, so give a few choices of exercises for kids to choose from. Make the activity fun. Start fresh. It's never too late to start exercising, especially as so many of us have been off schedule for so long. Start with small goals and build up. Just as physical activity plays a critical role in a child's psychological development, so does school. The simple act of going to school is so very important and yet will not be possible as the fall school year begins. Children are filled with the uncertainty of what will happen and when going back to school will become a reality. How can parents and adults help children despite the school year beginning remotely? Remember that your children see your actions and reactions. Show your excitement for the start of the school year. Take the same back-to-school pictures on the first day of school. Keep some of the regular back-to-school traditions. Go back-to-school shopping. Even if learning from home, buy some new clothes, maybe new shirts for Zooming, buy some new school supplies, a new backpack or a new organizer for books at home. Set up an area for school that is fun and special for your child. This both shows your excitement as well as the importance of a space dedicated for learning. I know if I tried to Zoom while attending school, Zooming from my bed, I would fall asleep in every class. Get kids excited about their nutrition. Involve them in planning for healthy snacks on school days. This will involve them and it will help busy parents too. Traditions are a critical tool for managing stress. They ground us in what can be expected during a time with so many uncertainties. And they give us something to look forward to at a time which is difficult and different for everyone. School and sports both play a role in what children see as normal. It offers grounding. It offers a sense of what to expect and is so important for their psychological health and emotional development. Together, as a community, we can make it through the challenges in our current reality, which is filled with so many uncertainties. We not only can make it through, but I'm confident we can come out stronger than even before. Thank you.
Thank you, Ms. Grimacy. We'll now go to questions from the room. Mr. Sheehan?
First off, could we go over the total numbers of cases and hospitalizations?
Yes, so we will be posting 6,704 cases today.
And then hospitalizations?
I don't have that number, but the number will be posted right after the press conference.
Okay, then going back to the department, or the State Department of Public Health, they had their press conference. 3 of you touched on it. They made the announcement today saying that on Monday they found out, but on Friday you guys made your announcement that it was last week that you guys were able to figure it out. Were you able to identify it first before they called you? And then can you also speak to how tough it is for the county to talk with the state to make sure everyone has the same numbers and the importance of those numbers?
So our team had noticed glitches in CalReady long before last week. And we had been communicating that, those glitches, those concerns to the state in emails, in conversations. So we were not formally informed by the state until Monday night that there was a huge backlog in processing of the results statewide. I think that we have a great relationship with the state. Both Dr. Ansorg and I are on regular calls, I want to say 4 times a week. In addition to that, our EPI team are able to reach out to them with questions about coding, about reporting, etc. I think it is critical for the local departments' numbers to match up with the state. And that is why we have focused the last 4 weeks on reconciling our total case numbers with the state.
And then the other one, just going back to a little bit more about Fiesta, you were talking about trying to be more creative with virtual possibilities. We've heard about different private events to try to keep the Fiesta spirit. Can you talk a little bit more about how you can have those private events if they want to have it, but stay safe and keep distance?
I think the only way to do that is virtually. Gatherings are not healthy. People need to recognize that even gathering with friends and family members who do not live within your household is a risk of spreading the virus. And so I think we're trying to be extremely explicit about Fiesta needs to be a virtual event this year. It cannot have a in-person component. Next, we'll go to questions on the phone.
Yes. Excuse me. Yes. First up, we have Josh Molina with Newshawk.
Hi, I have 2 questions. You mentioned recently that there was a surge in cases in Isla Vista. And I'm wondering if you have any sort of explanation for that. Is it related to the student population? Is it related to the sizable low-income population that shares that student population in Isla Vista? And what's being done to sort of address that situation?
Yeah, I can speak to that. We were informed by UCSB of large gatherings in Isla Vista because the dormitories at UCSB are closed. A lot of students who remain here live in Isla Vista in private homes, oftentimes 12 to 15 people sharing an apartment. So social distancing is not really an option under those circumstances, and that is the reason for a significant outbreak in some residences in Isla Vista.
But why is that happening now as opposed to a month ago or 2 months ago?
I do not have an explanation for that. I can only report to what is happening.
Okay, and also there's been, there are a lot of parents out there who are, when schools return, they're going to be doing things in the backyard with their kids and their friends, and they're going to hire a teacher or, somebody who can come in who has the time to monitor distance learning in the backyard. And so I'm hearing a couple things. I heard at the beginning that gatherings are not good. I presumably you mean indoor gatherings, but when we're talking about Fiesta, there's a lot of people who gather outdoors as well. What is the public health department's perspective on parents who are bringing in 4, 5, 6, 7 kids into the backyard to teach them, whether they're in the public school or they're all together moving out, and having a teacher or a person come in and sort of guide them in the backyard? Do you have any guidance or direction on that? I mean, we know now that COVID affects people of all ages. So what are your thoughts on this?
Well, the guidance from public health is very clear, and this practice is not encouraged. We encourage online learning, not in-person teaching, just because of the higher risk for infection. Now, having said that, we are not naive that we don't understand that some of these activities will occur, and this will obviously cause a little bit more mingling between children. However, to no degree will that resemble a mingling of opening a school. So it is still better to accept that, but our guidance is clear. We do not endorse it, and we don't recommend it.
So just to be clear, please just understand that when you're just kind of in the public, when you hear the public health officer say it's not encouraged, that sounds like don't do it. And then in the next breath, you hear you say, but it's better than going to school. I just don't know what people are supposed to take from that.
The recommendation from public health is very clear. It's not recommended because the risk of infection with COVID is high, especially in our area. We have a very high transmission rate, and that goes across all ages. So our recommendation is don't do it.
Thank you, Josh. Next up, we're going to Delaney Smith from Santa Barbara Independent.
Hi, I had a couple questions. One, I just wanted to start with farm workers. When we found out last week that there were 28 deaths that weren't counted, directly afterwards, the press release that came out said that 10 of those who died were farm workers in Santa Maria. I know that I hear quite often from public health that there's a lot of effort for outreach towards that population, but maybe you could get a little bit more specific. What does that outreach actually look like, and what concrete actions are being taken to address this super vulnerable population?
Sure. Delaney, I think we have an in-depth appointment next week for this interview, so I will just give you a prelude. We are involved with the Latinx and Indigenous community health, and through that we have partnered with multitudes of community organizations to not only do health education but also to provide critical information on testing, on treatment, on how to access healthcare services, as well as isolation and quarantine and wraparound services. So that effort has been in place since the beginning of the pandemic. In addition to that, we are partnering with our Ag Commissioner's Office to implement a state initiative called Housing for Harvest. And that is a program where we will enhance the isolation and quarantine services that we are providing currently to farm workers so that there are enhanced wraparound services to that community. So those are some of the highlights of what we are doing.
Okay, thank you so much. And then one other question goes to what Greg said at the beginning, which was the cruiser ride is a really bad idea, right? But I know that historically people make plans to book hotels and come to Santa Barbara for that way in advance. So I was just kind of wondering, was the county at all like thinking about that a month or two ago? Or was this just kind of like a realization more last minute that, oh, people are still planning on coming?
Yeah, I don't think that anybody made conscious plans a month and a half ago about this particular event. As the date came closer, it became clear that it was important to communicate with the event organizers that it wasn't a good idea. And as I said, those folks have been very cooperative. They understand that it's a fun tradition. It's something, that's worth preserving, but this isn't the right year to do it in the traditional structure. So what we're hoping is, what I specifically said was I think people can still ride a bicycle outdoors to get physical exercise. Ms. Grimacy spoke about how important that is for everyone in the community. But the idea of gathering in a group to do something like that together is so in conflict with what we're trying to do to encourage people to avoid that. We need to speak up about that very clearly. People will have come from distances to come and participate in that, and they just have to act like adults and not do it in a group. They're welcome to ride their bike anywhere around in town. It'd be great if they wore a mask, because there might be more people than normal riding their bikes around town because of this tradition. But it can be done safely if it's done on an individual basis, not in a group gathering.
Okay, thank you so much. That was it.
Thank you, Ms. Smith.
Thank you, Delaney. Next up, we're going to Fabiola Navarrete with Tu Tiempo. Fabiola, if you could unmute your mic. There you go.
Yes, thank you. Okay, good afternoon. Okay, I have my first question is about farmers, and I just want to know how many COVID cases have been reported from the company Alco Harvesting, and how many of them have been in the hospital?
I have 93 total positives since the beginning of the outbreak. However, not all 93 are active or in their infectious period. And I do not have the information on hospitalization, but more than happy to connect with you afterwards to verify.
Okay, thank you, thank you. My next question is about restaurants and businesses. Do you have any idea about when will the restaurants be open for indoor services, and also these other kind of businesses that still have other kind of restrictions?
At this time, there's no way to know what the future holds, but each of us can contribute to getting back to a sense of normalcy in some modified way, wearing face coverings and maintaining physical distancing, if we all commit to doing that more effectively and more consistently. But making predictions about the future course of the virus are impossible. It's impossible to do now.
Thank you so much, Fabiola. Next up, we're going to Laura Place with Santa Maria Times. Laura, can you unmute your mic? There you go.
Yes. Hear me.
Go ahead.
Hello.
We've had an issue with your audio before, Laura. I'm so sorry. Why don't you send it to me in writing, and I'm happy to ask your question for you. Apologies that there are audio issues. Next up, we're going to Catherine Swartz with Daily Nexus.
Hi, I had a couple follow-up questions about the number of cases we're seeing in Isla Vista.
First, what sort of communication has the county health department had with UCSB over the past 2 days since we've seen this rise of cases? I know that these are off-campus incidents, but they're still directly related to the UCSB community. So what has that communication been?
We are in very close communication with UCSB. UCSB has their own contact tracing program, which is very, very helpful and cooperates with us. We are reaching out with education and just pleading for those people. We also in the past have helped with putting up people in previous outbreaks in hotels if they couldn't isolate, so we are more than happy to cooperate with UCSB to make sure that the individuals can safely isolate and quarantine.
And my second question was, as discussed in the press conference about the underreporting of cases because of the CalReady system, is there any estimation of what numbers are looking like in Isla Vista right now and how underreported are they at the moment?
That would be so speculative, we're not even going to begin to try to answer that question. We do not have complete data available, and we know that, and we're saying that, and we're hopeful that the state system will be back operating later next week, and then we can again return to a sense of confidence about that information, but we do not have that information right now.
Thank you.
Thank you, Ms. Schwartz.
And next up, we're going to Raissa with San Ynez Valley Star.
Hi. Hold on one second. Can you guys be quiet, please? Sorry. Family members in the background. I wanted to ask, I've been asked some questions from the community about what occurs when someone dies in the county and they're positive with COVID. So how exactly do you get to the point to label them as a COVID death? Like, for instance, if someone dies in a car accident or from cancer and they're positive for COVID, does that automatically mean that the county is going to list them as a COVID death?
So far, we haven't had anybody in a car accident, dying in a car accident who also had COVID, fortunately. So that is the definition for a COVID death is very clear, and it is somebody who dies from symptoms of the COVID infection or who dies with the COVID infection. So a lot of the deaths occur at hospitals after very severe pneumonias. And some few deaths also occur at home, but the majority of deaths occur at hospitals.
Okay, so all of these people are pre-identified as having COVID. They're on your watch list and they're actively monitored, I guess.
Correct. Most of them are hospitalized and therefore treated for COVID at the hospital.
Okay. Thank you.
Thank you, Raissa. And next up, actually, Laura was able to send us her question. Her first question is, what was the date of the death that you've announced today?
Hold on one second. I actually did not share the date of death due to our compliance and privacy officer shared with me that we are not able to share date of death, and so therefore we are not sharing that today.
Okay, and her second question is, can you speak to some of the ways the county's status on the state monitoring list is impacted by these state data issues?
The state has shared that the monitoring list is frozen which means that I believe the last time I saw it updated was August the 1st. And so the state has paused that effort. Not only do we have inaccurate numbers of tests being conducted, we have inaccurate numbers of transmission, case counts, positivity rate. In addition to that, if you are on the state website, you will also note that there is not available notation for hospital capacity as well as hospitalization. However, I want to point out that if you visit our county, our local dashboard, we are able to extract that information from the data that our local hospitals are inputting into the state system. So we are not being held accountable. No one is, because the state does not have that information on their monitoring list.
Thank you, and that actually concludes the questions that we have from callers.
Thank you for those questions. Our next press conference will be Tuesday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home, don't go to work, and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today.